Hi, I'm Steve Adubato. Welcome to One-on-One. It is my pleasure to introduce Dr. Christopher Molloy, Senior Vice President, Research and Economic Development at the great Rutgers, the State University of New Jersey, my alma mater. Good to have you with us.
And mine too, Steve. It's a pleasure to be here.
Yeah, you got your proud Rutgers pin on.
I do.
In the Big Ten.
Yeah, so this has been a hell of a year at Rutgers, actually, Steve. Besides being in the Big Ten and adding...
What about the big merger?
Yeah, the merger is really the big story here in New Jersey.
With UMDNJ, University of Medicine Dentistry.
The majority of it in UMDNJ joined Rutgers about a year ago in July. I actually had the pleasure and the unfortunate circumstances to lead that merger.
Yeah, so we heard.
However, it's the largest one in the history of higher education. It's worked out extremely well. The UMDNJ folks have been able to recruit students as Rutgers now. They've graduated classes of medical students as Rutgers. They've been able to really anneal some of that research enterprise that they have in clinical trials to what our basic scientists can do at Rutgers, especially in the New Brunswick campus. And it's really doing extremely well, this merger.
You know, this merger, which was talked about for a long time, and a lot of people thought, hey, this will never happen. And then it happens, right? And so you think, okay, Rutgers, look at some numbers here. Under the merger, Rutgers has moved from 55th to 22nd place in Health Institute grants. It makes Rutgers huge, but I had more research dollars than ever before. Then I asked myself, okay, so what is the impact to the average person watching on public broadcasting right now and on FiOS? They say, okay, so what does this mean to me? I'm not part of that academic institution, you say?
Yes, but it's an economic development engine. Okay, so a big reason that the pharma companies have moved some jobs to areas like Boston and San Diego.
We've lost them.
We've lost them, but we haven't lost them forever. There's still a huge pharma presence here and a huge and a growing biotech presence because of the talent that pharma shed from industry. Our new revamped university is able to bring in research dollars and multidisciplinary grants. Rutgers now has access to medical research at the bedside where physicians are seeing patients and treating patients. An example of that is this $10 million gift we just got, an anonymous gift to support cancer genomics, that is studying how individual cancers and individual patients can be treated by personalized drugs or targeted drugs.
A $10 million?
$10 million anonymous gift.
Are you saying, Kristen, you're not sure that that would have happened if the merger hadn't happened?
No, the merger completely enabled that.
Really?
Completely. Because we're able to take Dr. Jay Tishfield's cell and DNA repository, his Infinite Biologics, which is a high throughput way to keep cells and study cells and genomes in culture, with the patient samples that can come from CINJ and use that targeted
Cancer Institute of New Jersey.
Right.
Translate that again to what that could potentially mean, because research,
okay, so Rutgers,
pipeline stuff down the line, what does it mean?
Rutgers is in a position to do state-of-the-art precision medicine on individual patients' cancer tumors. State-of-the-art in an NCI Comprehensive Cancer Center designated by the National Cancer Institute. Really, we're one of the few in the country that can do that, and this is going to benefit the citizens of New Jersey. Likewise, we have a strong research portfolio in infectious disease. You know that there's many issues with MRSA and other types of infectious disease components. We just got a federal grant, multidisciplinary grant, $26 million from the NIH.
National Institutes of Health?
National Institutes of Health.
Are you saying that grant, as you talk about it, may not have happened?
It would not have happened.
Rutgers had not merged with
It's a collaboration between the terrific scientists at the Public Health Research Institute in Newark and our scientists in New Brunswick that are working on infectious disease.
What could all this mean for the students of Rutgers?
Well, they have opportunities now to train from their undergraduate degrees into working in research labs that work on medicine, dentistry, public health, a whole variety of things that they couldn't do before. The other thing that really is important here to note, though, is that the biotech industries that want talent that is trained broadly across the whole paradigm of research from basic science all the way to clinical medicine will be able to access that directly in one university. So part of my responsibility is to have a business practice enterprise at Rutgers that makes it easy to do corporate contracts, that has concierge service for business development folks to be able to interact directly with these companies, for them to sort of know who to go to and how to work with such a tremendously large university.
Is this really about bringing more business into the state?
It's about bringing more and keeping some here. And
that we might lose to the Bostons or the Silicon Valleys of the world?
And the truth of the matter is that those universities up there aren't that easy to work with either. We're really rebooting Rutgers to be able to do that. And we're collaborating with NJIT, Princeton, and a bunch of other universities as well.
To what degree does it raise the brand of Rutgers? And I'm thinking about this. Rutgers has a solid reputation in a lot of ways. But to what degree does it raise the brand of the university?
Well, you know, the university has a strong brand, but you know, Steve, as you know, we both went there. It's almost 250 years old. But it was a private university until the 1950s.
A land-grant university?
Land grant university then, but really private, and really didn't have that state support that the Michigans and the Penn States
not Michigan
had.
State, not Penn State.
Right, until later. And New Jersey's been kind of playing catch-up, even though we have now the oldest university in the Big Ten. With President Barchi, the new president, who's the first scientist to be president at Rutgers, actually a physician scientist. And with this bipartisan coalition that supported this merger with the former UMDNJ, we've really now created that Big Ten kind of university, big public university that can support basic science and economic development. Let me tell you, in the Big Ten, there are now 14 schools, as you know.
Right.
In terms of patent licensing, from research patents, Rutgers is number 5 out of those 14.
What does that mean?
In other words, some of the technologies and inventions that have happened both at UMDNJ and Rutgers.
Put them together and
It's almost $17 million in annual licensing revenues coming into the university that helps support continued research, but also is really a way to jumpstart companies. And we've launched about 100 companies over the last several years.
With all that money coming in, how do you keep tuition level? Because that's not happening. It's always going up.
This is the balancing act that all state universities happen. As you know, it's more and more expensive to pay employees. It's more and more expensive to do research. All states are stressed with supporting their public universities. Something has to give. We're trying to create new revenue streams with this economic development, sponsor research, work with industry to sort of offset some of that tuition.
And hopefully in the process we keep more of the best and brightest right here in the state.
Well, I'll tell you, a lot of the best and brightest are applying now to medical schools here because it's Rutgers.
Dr. Christopher Molloy, Senior Vice President, Research and Economic Development at Rutgers, the State University of New Jersey. Thank you, Chris. Appreciate it.
My pleasure.
This is One on One. We'll be right back right after this. Stay right there.